Hi, in this video, I am going to give some important GPAT questions in related to general pharmacology. So, which of the following is a phase 2 drug metabolizing reaction? Acetylation, deamination, hydrolysis, oxidation, and reduction. So, among these, the phase 2 drug metabolizing reaction is the acetylation. Next question, if the plasma concentration of a drug declines with first order kinetics, this means that so there is only one metabolic path for drug disposition. The half-life is the same regardless of the plasma concentration. The drug is largely metabolized in the liver after oral administration and has a low bioavailability elimination. The rate of elimination is proportionate to the rate of administration at all the times. So here the answer for this plasma concentration of a drug declines with first order kinetics is the half-life is the same regardless to the plasma concentration. And next question regarding termination of drug action. So regarding the termination of drug action, so which is the suitable statement? So drug must be exerted from the body to terminate their action. Metabolism of drugs always increases their water solubility. Metabolism of drugs always abolishes their pharmacological activity. Hepatic metabolism and renal excretion are the two most important mechanisms involved, and distribution of drug out of the bloodstream terminates the drug's effect. So regarding the termination of drug action, so the hepatic metabolism and renal excretion are the two most important mechanisms you can observe in the termination of the drug action. So next question, a physical process by which a weak acid becomes less water soluble and more lipid soluble at low pH. So that is distribution, elimination, first pass effect, permeation and protonation. So among this, the weak acid becomes less water soluble and it is becoming more lipid soluble at low pH is nothing but protonation. So E is the answer. And next question, the following are excreted faster in basic urine. So which drugs are mostly excreted or faster in the basic urine? Either weak acids, strong acids, weak bases or none of the above. So among these, the which are faster in basic urine means nothing but weak acids. So answer is the A. Next question, which of the following drugs may inhibit the hepatic microsomal P450 responsible for warfarin metabolism? So in the warfarin metabolism, which drug is inhibiting the hepatic microsomal P450? So among seeing the options, cimetidine, ethanol, phenobarbital, procainamide and rifampicin. So among this, the answer is the cimetidine. So it is a H2 blocker. So with regards to clinical trials of new drugs, which of the following is most correct? So if you observe, phase 1 involves the study of small number of normal volunteers by highly trained clinical pharmacologist, and phase 2 involves the use of new drug in a large number of patients, 100 to 5000 who are the disease to be treated, but it is a wrong statement. 100 to 500 only the limit in the phase 2. And C, phase 3 involves the determination of the drug therapeutic index by the Cauchy's in the induction of toxicity. So that we are seeing in the phase 2, not in the phase 3. And phase 2 requires the use of positive control and a placebo. So this is also wrong answer. So correct answer is the A. The phase 1 involves the study of a small number of normal volunteers by highly trained clinical pharmacologist. So that is accurate or most correct we can observe in the case of clinical trials. So next question, phenylephrine causes. So either constriction of vessels in the nasal mucosa and increased gastric secretion and motility and increased skin temperature, meiosis and all the above. So if you observe among these, so the phenylephrine, it is related to the constriction of vessels in the nasal mucosa. So phenylephrine is used to relieve the nasal discomfort caused by the colds and allergies and have hay fever. It also used as a relief in sinus congestion and pressure. So next question, the pre-treatment with propanol will block which of the following? So among the options, that is methacholine, induced tachycardia, nicotine, induced hypertension, norepinephrine induced bradycardia, phenylephrine induced mydriasis, and answer we can observe that is propanol will block the which of the following is nothing but methacholine induced tachycardia. And next question, the Ames test is a method for determining. So carcinogenesis in rodents, carcinogenesis in primates, teratogenesis in any mammalian species, teratogenesis in primates, and mutagenesis in bacteria. So the Ames test is mostly using for the mutagenicity finding in the bacteria. So answer is E. And next question, the nicotinic sites include all of the following except so bronchial smooth muscle, adrenal medullary cells, parasympathetic ganglia, skeletal muscle, and sympathetic ganglia. So among this, which it is including means all the following except means that is bronchial smooth muscle, it is not present, nicotinic sites. So in the remaining all these, the nicotinic sites are present. So answer is the bronchial smooth muscle. So next question, a good example of chemical antagonism. So here you can see the options like heparin and protamine and zinc, heparin and prothrombin, and all the above. So among these options, so the most chemical antagonism we can observe the heparin and protamine. So answer is A. And next question, which property is classified as colligative? Colligative properties, solubility of solute, osmotic pressure, hydrogen ion concentration, dissociation of solute, miscibility of the liquids. So answer is osmotic pressure, it is classified into the colligative properties. Next question, the pH of buffer system can be calculated with the, so we can observe the options like a Nash-Whitney equation, Henderson-Hasselbalch equation, Michael-Menten equation, Young equation, and Stokes equation. So among that we know that the pH of buffer we are finding by using the Henderson-Hasselbalch equation. So answer is B. Next question, which mechanism is the most often responsible for chemical degradation? So you can see the options like racemization, photolysis, hydrolysis, decarboxylation, and oxidation. So in which mechanism most of the responsible for chemical degradation? So degradation is mostly happens in the hydrolysis condition. So answer is C. And next question, which equation is used to predict the stability of a drug product at room temperature? So for experiments at accelerated temperature. So the Stokes equation, given the options, the Young equation and Arrhenius equation and Michael-Menten equation and Hickson-Crowell equation. So the answer for this to predict the stability of drug product is nothing but Arrhenius equation. Answer is C. And next question, rectal suppositories intended for adult dose usually weigh approximately. So we can see 1 gram, 2 gram, 3 gram, 4 gram, and 5 gram. So approximately the weight of the rectal suppository is 2 grams. So answer is B. And the passage of drug molecules from a region of high drug concentration to a region of low drug concentration is known as. So the drug is moving from the high to low concentration. We are calling it as active, either active transport, bioavailability, biopharmaceutic, simple diffusion, and pinocytosis. So by this high drug to low drug concentration is nothing but simple diffusion. Answer is D. Next question, the loading dose, that is DL, of a drug is usually based on the, so it is total body clearance of the drug or percentage of drug bound to plasma proteins, fraction of drug excreted unchanged in the urine, and apparent volume of distribution and desired drug concentration in the plasma, and area under the plasma drug concentration versus time curve, AUC. So among these, the loading dose of a drug is usually based on the apparent volume of distribution, that is the volume of distribution VD, and desired drug concentration in the plasma. So basing upon these two, the loading dose is going to dependent. Next question, the renal clearance of insulin is used as a measurement. So effective renal blood flow and rate of renal drug excretion and intrinsic enzyme activity, active renal secretion, and glomerular filtration rate. So the renal clearance of insulin, it is used in the measurement of glomerular filtration rate. So answer is E. So DAS is expressed in both the intestinal epithelium and the kidney. So you can see the option cytochrome 2d6 and 1A1 or 2, and cytochrome 3A4 and cytochrome P2E1. So among this, which is expressed in both intestinal epithelium and also in the kidney. So that is nothing but cytochrome P3A4. So answer is 3. So the initial distribution of drug into tissue is determined chiefly by, so the initial distribution of drug in the tissue we are chiefly we are estimating by rate of blood flow to tissue, or glomerular filtration rate, or stomach emptying time, and affinity of the drug for tissue, or plasma protein binding of the drug. So we can estimate this by using the rate of blood flow to tissue. So this, by using this, we are estimating the distribution of drug in the tissue. And next question, which tissue has the greatest capacity to biotransfer the drugs? So to biotransfer, which tissue are is having the major greatest capacity? So you can see brain, kidney, liver, lung and skin. So the liver is having the more biotransformation of the drug. That is nothing but metabolism. So answer is C. Next question, which of the following compounds are considered the building blocks of nucleic acids? So nucleic acids to made, so which are the building blocks? So you can see the options like nucleotides, nucleosides, monosaccharides, purines and amino acids. So the building blocks of nucleic acids are nothing but nucleotides. So answer is A. And which of the following terms best describes a cofactor that is firmly bound to an apoenzyme? So which is binding the cofactor to the apoenzyme? So holoenzyme, prosthetic group, coenzyme, transferase or heteropolysaccharide. So the answer is a prosthetic group, whatever it is attaching to the cofactor we are calling it as a firmly bound to the apoenzyme. Next question, which class of antibody has the longest serum half-life and absonizes antigens for phagocytosis through two different pathways? So you can see the options like immunoglobulin G, IgM, IgA, IgE we can observe. So among this, longest serum half-life and opsonizes antigen for phagocytosis is nothing but immunoglobulin G. IgG is the answer. Next question, the sugar that is inherent in the nucleic acid RNA and DNA is. So which sugar is mostly present in the RNA and DNA? Either glucose, sucrose, ribose, digitoxose or maltose. So answer is the ribose. It is mostly present in the RNA and DNA. And next question, that is N-oxidation will be involved in the metabolism of following drugs. So among the drugs in which except. So see the answer clearly, except which drug the metabolism is happening in oxidation. So dapsone, meperidine, phenytoin, chlorpheniramine and chlorpheniramine. So among these four, so all are undergoing the N-oxidation except the drug that is phenytoin. So phenytoin does not undergoing the N-oxidation. Next question, which of the following organisms can use only molecular oxygen as the final acceptor? So that is obligate anaerobes, facultative anaerobes, obligate aerobes and strict aerobes we can observe. So among this, which is happening, that is the obligate aerobes is use only the molecular oxygen it is utilizing for final acceptor, that is obligate aerobes. Next question, a declining growth rate occurs during which of the following phases of bacterial cell growth? So declining growth we are observing in the bacterial cell growth. So the different phases like log phase, exponential phase, stationary phase, death phase we can observe. So the declining growth is nothing but we are observing in the death phase. So D is the answer. Next question, which of the following drugs is considered to be the agent of choice for anaphylactic reaction? So edrophonium, ipratronium, ambinonium and propanthelin. So among the homotropin. So among this, which one is mostly considering the agent for the anaphylactic reaction is nothing but the ipratronium. So B is the fluorescent has a pK of 8.2. So what percentage of fluorescent will be ionized at urine pH 5.2? So the pK of fluorescent is 8.2 and what is the percentage of fluorescent is ionized at the pH 5.2? So either 0.1 percentage, 1 percentage, 50 percentage or 99% or 99.9 percentage. So 99.9 percentage is the correct answer for fluorescent ionized at the pH 5.2. And next question, the appropriate pH range for ophthalmic products is. So ophthalmic products, so what is the appropriate pH range? So you can consider here the options like 2.0 to 3 and 4 to 6, 6 to 8 and 8 to 10. So approximate pH is for ophthalmic products is 6 to 8. And next question, the drug administered through which of the following routes is not likely to be subjected to first pass metabolism? So like oral, sublingual, subcutaneous, rectal. So the drug administered through which of the following route is not likely to subject to the first pass metabolism, nothing but oral. And next, bioavailability of drug refers to. So that is percentage of administered dose that reaches systemic circulation in the unchanged form, or ratio of oral to parenteral dose, ratio of orally administered drug to the excreted in the fecus, and rate of drug excreted unchanged in urine to that excreted as metabolites. So among this, the correct answer is the A, that is percentage of administered dose that reaches systemic circulation in unchanged form. That is we are calling it as bioavailability of the drug. So next question, biotransformation of drugs is primarily directed to. So that is active the drug, activating of the drug, and inactivation of the drug, or convert the lipid soluble drugs into non-lipid soluble metabolites, and convert non-lipid soluble drugs into lipid soluble metabolites. So biotransformation or metabolism is nothing but to aim the to convert the lipid soluble drugs into non-lipid soluble drugs. So that is increasing the to increase the polarity. So answer is the C is the answer. And next question, G protein coupled receptor span the plasma membrane as a bundle of dash alpha helix. So you can see 1, 3, 7 and 10. So answer is 7. 7 alpha helix are present. And next, drugs which undergo high degree of first pass metabolism in liver. So which drugs are highly undergoing the first pass metabolism in the liver? Have oral bioavailability, are excreted primarily in bile, are contraindicated in the liver disease, or exhibit zero order kinetics of elimination. So which are having the high oral bioavailability, they are mostly undergoing the first pass metabolism in the liver. And next question, glomerular filtration of a drug is affected by its lipid solubility or plasma protein binding or degree of ionization or rate of tubular secretion. So glomerular filtration of a drug is completely affected by the plasma protein binding. So if it is more binding, the excretion is low. And next question, which of the following is not a primary or fundamental but a derived pharmacokinetic property parameter, that is bioavailability or volume of distribution, clearance, plasma half-life. So which is not a primary or fundamental derived pharmacokinetic parameter is nothing but the plasma half-life. Remaining three are related to the pharmacokinetic properties only. And if a drug has a constant bioavailability and first order elimination, its maintenance dose rate will be directly proportional to its. So you can see volume of distribution, plasma protein binding, lipid solubility, total body clearance. So total body clearance. So if the drug has a constant bioavailability and first order elimination, its maintenance dose rate will be directly proportional to the how much of total body clearance. So it is dependent. Next question, monitoring plasma drug concentration is useful while using either antihypertensive drugs or levodopa or lithium carbonate or MAO inhibitors or so among these, so the to monitoring the plasma drug concentration, so which is we are using means the lithium carbonate condition we are using this plasma drug concentration monitoring. Next question, so which of the following is a competitive type of enzyme inhibitor? So like acetazolamide, disulfiram, physostigmine, theophylline. So among these, which is having the competitive type of enzyme inhibitor is nothing but physostigmine. C is the answer. And next question, a partial agonist can antagonize the effects of full agonist because it has high affinity but low intrinsic factor, low affinity but high intrinsic factor, no affinity and low intrinsic factor, and high affinity but no intrinsic factor. So a partial agonist can antagonize the effects of full agonist because of its high affinity but low intrinsic factor. So by this it is completely agonistic the antagonizing the effects of the full agonist, that is partial agonist. So next question, all of the following subserve as intracellular second messengers in receptor mediated signal transduction except among the given options which is not having the messenger, that is which is not a secondary messenger. So examples like cyclic AMP, inositol triphosphate, diacyl glycerols, G protein. So the G protein is the answer. So it is a protein. So these are the chemical messengers. Next question is a receptor which itself has enzymatic properties. So that is insulin receptor, progesterone receptor, thyroxine receptor, glucagon receptor. So which is having the enzymatic properties nothing but the insulin receptor. It is going to produce the enzymes also. So next question, which of the following is a G protein coupled receptor, that is a muscarinic cholinergic receptor or nicotinic cholinergic receptor, glucocorticoid receptor or insulin receptor. So the which one is a G protein coupled receptor is nothing but muscarinic cholinergic receptor is a G protein coupled receptor. Next question, the drug efficacy refers to. So what is meant by drug efficacy? So it is related to the range of diseases in which the drug is beneficial, the maximal intensity of response that can be produced by the drug, the therapeutic dose range of the drug, and the therapeutic index of the drug. So which statement is correct to the drug efficacy is nothing but the maximal intensity of response that can be produced by the drug is the correct definition for the drug efficacy. Next question and last question in this video. The therapeutic index of the drug is a measure of its so either safety or potency or efficacy or dose variability. So among these, so which is where measuring by using the therapeutic index of the drug is nothing but safety we are identifying. So A is the answer. So if you like this video, please subscribe to my channel and share to your friends. Thank you.